Good morning and welcome, everyone. I'm Kim Hanson, Executive Director at Diabetes Canada. We're here today to talk with those of you, with our listeners, about how members of the Metis community who are living with diabetes or prediabetes can manage and find support during the COVID-19 pandemic. We're really pleased today that we'll have remarks from Member of Parliament for St. Boniface, Minister Dan Vandal. I'm also really pleased to be joined today by Minister of Health for the Manitoba Métis Federation, Francis Chartrand, and by Dr. Goulet of the Max Rady College of Medicine in Winnipeg. So thank you all very much for being here. Today, our experts will be answering some key questions that Ministers Vandal and Chartrand and we at Diabetes Canada have been hearing from our constituents related to the relationship between COVID-19 and diabetes, and how those of us with diabetes can best care for ourselves during this strange pandemic period. We would also love to take questions from you, our viewers. Please feel free to submit your questions using the Q&A function if you're joining us by Zoom, and using the comments on Facebook if you're watching from Facebook Live. Just for your information, we are recording this session and we'll be making the recording available on Diabetes Canada's YouTube channel so that you can watch it back and share it with any of your friends that you wish. So, thanks again, Minister, for being here. To begin our session, we'll start by hearing some words from Minister Vandal on the burden of diabetes for many Indigenous people in Canada and how our federal government is helping people with diabetes through the pandemic.
Merci de l'invitation. I'm very happy to be able to contribute to this important discussion on diabetes. The Government of Canada recognizes the impact diabetes has had on the health and well-being of Canadians. Approximately 3 million Canadians are living with diabetes, and 200,000 new cases are diagnosed each year. We are working to prevent diabetes in the first place and to ensure that better treatments are available following diagnosis. Over the last 5 years, we have invested $229 million towards important diabetes research, with over $48 million funded in 2018-2019 alone. Unfortunately, diabetes disproportionately affects Indigenous people in Canada. And today, a 20-year-old in Canada faces a 50% lifetime chance of developing diabetes. If that 20-year-old is Indigenous, the risk rises to 80%. Indigenous people continuously demonstrate strength, resilience, and leadership. The National Indigenous Diabetes Association website highlights countless examples of successful programs that are Indigenous designed, led, and implemented in communities right across Canada. NIDA's Indigenous Diabetes Conference provided an opportunity for the work of community leaders to showcase the programs and initiatives that have been undertaken in their communities. The history of colonialism and residential schools has had a long-lasting effect on the physical, spiritual, emotional, and mental well-being and health of Indigenous peoples. Les peuples autochtones du Canada comptent parmi les populations les plus à risque de diabète et de complications connexes. Les données d'enquête nationales ont constamment démontré que la prévalence nationale du diabète ajusté selon l'âge est de 3 à 5 fois plus élevée dans les populations autochtones que dans la population générale. Our government is working to both improve the lives of Indigenous peoples and ensure our relationship recognizes the distinct culture and realities. A distinctions-based approach is needed to ensure that the unique rights, priorities, and circumstances of First Nations, Inuit, and Métis nations are acknowledged, affirmed, and implemented. We are providing funding for existing health programs as well as greater support for distinctions-based healthcare, data collection, and delivery, and for the expansion of Indigenous health systems that are increasingly delivered and controlled by and for Indigenous peoples. Travaillant en partenariat, nous faisons des tests et nous augmentons les interventions dans les communautés à travers le pays pour prévenir le diabète. These interventions focused on common risk factors for chronic diseases, including diabetes, such as unhealthy eating habits and physical inactivity. We will keep working to help Canadians with diabetes to make healthy choices, from helping them quit smoking to getting active and eating healthy. Notre gouvernement continue à chercher les moyens pour soutenir les Canadiens et les Canadiennes souffrant de diabète pendant cette pandémie et au-delà. Thank you very much.
Thank you so much, Minister Vandal. Now I'd love to welcome Minister Chartrand. Minister, thanks for being with us. Can you speak to us about how diabetes fits in with the priorities of your department, particularly during the pandemic, and how that impacts members of the Métis Nation?
Thank you for inviting me. Good morning, everyone. I'd like to thank you for inviting me to participate in this discussion. As the Minister of Health, I am concerned about the prevalence of diabetes in the Métis community. In our 2010 Métis Atlas, it's confirmed that provincially more Métis have diabetes compared to all other Manitobans across the province, 12% versus 8.9%. Even after taking into account factors such as age, income, Métis are at greater risk of developing diabetes compared to all other Manitobans. We just heard the minister speak about how Indigenous peoples across Canada and across Manitoba are at higher risk because of lack of supports and services across the province of Manitoba. Diabetes also affects and is affected by mental health. And I am sure that the general population, general public do not understand that. Métis with diabetes are more likely to have depression, anxiety disorders, substance abuse compared to other Manitobans with diabetes. Métis with diabetes use health services to treat diabetes and its associated complications more frequently than do all other Manitobans with diabetes across the province of Manitoba. For example, their doctor visits. They have 10% higher rates for doctor visits, 20% more hospital visits, 30% more short hospital stays, and 10% more types of prescriptions and medications. And in our small communities, there's no medical facilities to assist or help our Métis citizens. Some of our citizens have to travel an hour to 2 hours to go to a medical facility, to see a doctor, to see a nurse practitioner. In fact, there's a wait list across the province of Manitoba for a doctor in each of our facilities, in each of the hospitals across the province. However, during the pandemic, our government has worked to ensure to the health and well-being of our citizens. In fact, we formed a COVID-19 task force to strategize and address the needs of our citizens across the province, including those who reside in rural or remote areas where there's limited access to medical facilities and supports. So our plan included the development of 2 isolation camps. One was in Winnipegoses and one was in Treehorn, and the acquisition of 5 tiny homes in the event of COVID-19 impacted one of our communities. It was necessary to quarantine individual and provide medical supports. I would like to thank Dr. Goulet, Dr. Sanguins, Dr. Dreger, Shanley Scott, and Rochelle Note that were assisting with ensuring that we had a plan to move into the isolation camps for the communities. I'd also like to thank all the staff for their hard work, commitment, and dedication that work out of 150 Henry and our regional offices across the province of Manitoba. Our government initiated daily website updates. And we all know a lot of our seniors and elders and some of our remote communities do not have access to internet. So what we did was we got staff to conduct over 3,000 wellness checks on a daily basis to our citizens across the province. We want to ensure that our citizens were staying at home and that we were phoning in to check up on them. We want to ensure they had access to essential items such as food and medication. We want to make sure that someone was there speaking with them, ensuring that they were safe and healthy. A lot of our seniors and our elders had a difficult time and are still scared today of COVID-19. It's still unforeseen and it changes on a day-to-day basis. So with everyone saying that everything's okay and we flattened the curve in Manitoba, we still have to ensure and be aware of COVID-19. So we also implemented a hamper program. A lot of our small Métis communities across the province of Manitoba do not have stores, do not supply healthy foods, hence the diabetes, the unhealthy habits, and that's why our citizens are suffering today. So what we did was we ensured that we had nutritious food and sanitization products delivered right to our seniors across the province and our vulnerable citizens. We delivered to over 5,000 households in the province of Manitoba, supporting approximately 10,000 citizens and children, elders, family members across the province of Manitoba. And we're continuing right now to stockpile just in case there's another wave and then our citizens have to be home. And we know the shortage of food going out to the communities, food going out to the urban centers. We have to make sure that we have a plan and we have to be prepared. Our Minister of Finance that was responsible for HR, the Métis government in home office, is also working on a emergency plan. They're working on a policies to ensure that the staff are taken care of. The Premier of Manitoba did not recognize our workers as being essential workers. Our Métis community liaison staff, our line staff, were delivering hampers on a daily basis right across the province of Manitoba. In November of 2017, our government launched a prescription drug program. And we all understand that our elders and seniors will care for our grandchildren. They'll make sure that they could pay their hydro bill. They'll make sure that they can buy groceries as opposed to ensuring they have medication. So our prescription drug program that was launched in November 2017 is on a needs basis. And how it works is that we pay, the Métis government will pay for your pharmacare deductible, ensuring that you get your medications across the province of Manitoba. So we have a pharmacy that's Métis owned. It's called Needle Care Pharmacy, and it is located at home office at 150 Henry. This pharmacy is an economic development venture that will assist and pay for our programming and supports that we have from our Métis citizens across the province of Manitoba. So presently we have staff across the province that do intake and meet with our elders and seniors that can utilize and have access to our Needle Care Pharmacy. And our pharmacy is not only for our programming, it's also for the general public, and it's for our Métis citizens across the province of Manitoba. So when we're talking about pharmacy and making sure that our citizens and our elders have access to their prescriptions, we ensure 24-hour to 2-day delivery across the province of Manitoba. I'd like to thank Shanley Scott, who is the general manager of Needle Care Pharmacy, and ensures that our citizens are taken care of all across the province. We also offer another program, and our program is the Vision Care program. We partner with a company in the city of Winnipeg, and we know that individuals with diabetes require careful vision monitoring. The program criteria is the same as the prescription drug program. It's on the need basis. Our partnership is with Vision Eye Care in the city of Winnipeg. They have 3 sites. One site's in St. Vital area, another site is at Northgate Plaza, and one is on Anderson Highway. So we have a team of doctors that travel to our communities to provide vision testing and fit our citizens for eyewear. I don't know if the general public is aware that glasses are quite expensive. For example, when you start aging, and your glasses sometimes can cost anywhere from $500 to $700 a year, then you have to go for different testing. So with the province of Manitoba, they're responsible for eye tests and eye exam for our elders. However, when you're a diabetic and you have to go for testing, there's different tests that you have to go for that are not covered by the province of Manitoba. So with our Vision Care program, our Métis government ensures that all these tests are covered, and we have a full partnership that we could go to each of the communities that wear bifocals that need extra attention to their eye. So we make sure that that they have progressive lens bifocals, and it's available to all citizens. And if you go to any of these clinics and you have your citizenship card, they will assist you. And then I believe the glasses are approximately $150 to $200. So for example, I wear bifocals. So my bifocals in the city of Dauphin were $475. So if you're living on a limited income and you don't have insurance, and your limited income is approximately $1,200 to $1,400 a month, will you pay for hydro? Will you pay for food? Or will you get your glasses? So we have to make sure that we have programs and services that will assist our elders and our citizens across the province of Manitoba. We recognize the importance of community partnerships and are grateful for our relationship with Diabetes Canada and DynaCare. We have been able to offer diabetes education seminars, risk assessments, foot care clinics, as well as blood glucose and AC1 testing. And I'm totally scared of needles, so everyone be very careful, but it was okay and it was comfortable when we did our AC1 testing. We look forward to our partnership. I would like to thank our elders, youth, and Métis citizens, our cabinet members, Minister Vandal, Dr. Goulet, Kim, and others in Diabetes Canada staff that made the webinar possible, as well as everyone that took the time to join us today. I would also like to thank our elders for their wisdom, guidance, our youth for their willingness to learn, and our citizens for their continued support across the province. Whether you live in Thompson, you live in Dauphin, you live in Duck Bay or Winnipeg, we should all have access to programs and supports and medical help. Thank you very much.
Minister, thank you. That's a really impressive and inspiring list of supports that you've delivered to your community for COVID and related to diabetes, and Diabetes Canada is thrilled to continue to partner with you. So thank you for sharing that. Now I'd like to welcome Dr. Sara Goulet. Dr. Goulet, thanks for being with us today. Tell us, people living with diabetes are wondering whether they're at greater risk for COVID-19 because they live with, whether it's prediabetes or diabetes. What would you tell them?
Well, thank you very much for inviting me. I'm honored to be here. There certainly is an association that has been found all over the globe that would say that people living with diabetes are at higher risk of having not getting COVID, but there's some association with people being more sick who have diabetes and then also have the virus COVID-19. So people living with diabetes have to be more cautious than the general population to protect themselves against contracting the virus or being near somebody who is sick with COVID-19, because they may become more sick than someone else. So it is important to take care of yourself if you have diabetes, to make sure that you're checking your blood sugars every day, and that you're calling your healthcare facility, your nurse practitioner or physician if you're finding your blood sugars are going up. So if they're higher than 10 when you're taking them in the morning, you might want to contact your healthcare provider to find out ways that you could help to lower them. You want to make sure that ways to protect yourself would be to make sure that you're eating really healthy, nutritious food, because that's protective. It helps our immune systems to be strong. Getting enough sleep also helps us to have a strong immune system, so that if we come into contact with a virus, that our bodies are able to try to fight it off themselves. And making sure that we get enough exercise, either from yoga or going for a walk. One of the things that public health has been very clear with us is that being outside and making sure we maintain social distancing, so staying 2 meters or 6 feet apart from other people, is very safe. And the chances of us contracting a virus from somebody outdoors, especially while it's summer, is very, very low. Like almost nothing. So it is important to get outside. You don't have to stay in your house all the time, but just make sure to stay away from people. If you are in a situation where you need to be near somebody than 6 feet or 2 meters, then it is a good idea to wear a mask. There are many, many places in Canada, including Quebec, you might have seen on the news, that has decided in all public places that masks are mandatory. So there is some evidence from around the world, again, as we're learning more and more about COVID-19, that wearing a mask could be protective. And while you're wearing the mask, you're actually protecting other people. So if you're in spaces that are close contacts, you want to make sure to be wearing a mask. Always make sure to wash your hands. That's probably the most protective thing you can do for COVID-19 to protect yourself. So when you leave your house and you come back, or anyone else comes back into your house, make sure the first thing that you do is wash your hands. If you're out in public and you have access to washing your hands, make sure you're using the alcohol or hand sanitizer. Wash your hands frequently and try not to touch your face, because you can touch COVID on a surface, and then if you touch your eyes or your nose or your mouth, which we all do frequently, they say we touch our faces 200 times a day, then you'll lower the risk if you've washed your hands. So that's very important. You can access more information from the Diabetes Canada website on Diabetes Canada COVID-19 facts sheet. So you can Google that for more information. If you have any questions about your diabetes, you can call Diabetes Canada 100 Banting, BANTING line. And a certified diabetes educator is there to respond to your questions 24 hours a day. So that is a very good resource and something that I think could be very effective.
Thank you, Dr. Goulet. That's really helpful advice for those of us affected by diabetes. Now, what would you advise for someone who's wondering how they can best access healthcare during this time where many doctors' offices might be closed or only offering remote visits? And how can folks take care of their diabetes on their own while we're in this period of social distancing?
That's a very good question, and one that I've heard from a lot of my patients. There is a lot of fear around accessing healthcare because of the concern of being in touch with someone who might be sick with COVID-19 while you're accessing care when you don't have it. So for that reason, primary care clinics and physicians and nurse practitioners are still working very hard during this time. But they have moved to something called virtual care, which means that they will try to take care of your needs over the phone so that you can stay at home and you don't have to come to a clinic. And so you can still call your doctor's office or call to get in contact with your nurse practitioner. And if they can help to manage your specific concern over the phone, they will. If they feel there's something that they would need to see you in person to do an exam or to check your blood pressure or other vital signs, they will ask you to come to the clinic. Clinics have been giving people very spaced out appointments and making sure that their waiting rooms would allow for social distancing. So they're much more structured than probably previously when you've gone to a doctor's clinic. And there's lots of safety precautions in place to make sure that if you do have to visit the clinic, that you can maintain social distancing and protect yourself. As well, when you walk in the door, your doctor's office or your nurse practitioner will screen you. And if you had any symptoms, you would be put in a separate room or asked to go to a testing site for COVID prior to being able to visit the physician for your other concern. And this would be true of anyone else visiting the clinic as well. So in theory, there won't be people with symptoms sitting in the waiting room because the doctor does not want you to contract COVID-19 if you were to come and visit them. It is also very safe to still visit an emergency department. So if you are having symptoms like chest pain or shortness of breath or something that you would not be able to wait to see your doctor in their office or to call your doctor, the emergency rooms in Winnipeg and all over Manitoba have done also things to make sure that you can social distance and to try to protect people who have symptoms and keep them away from people who don't. So it's very safe to go to an emergency department and make sure that you have your other health conditions taken care of. As important as COVID-19 is, and the fact that we want to try to make sure that we don't have more people contract the virus that are necessary, it is also important that we take care of our chronic disease needs, our diabetes, our blood pressure. We don't want to ignore those things during this time because there are obviously other health conditions that continue. So we want to make sure that we're taking care of our chronic disease, and that if you're having symptoms, you're not ignoring them or being fearful of going to an emergency department where your needs could be taken care of so that you can be well. Make sure that if you have diabetes, that you are doing the basic things that your physician or nurse practitioner has told you about before. So make sure to have a look at your feet. You can ask someone else in your house to look at your feet. It's very common when we have diabetes that people lose some of the sensation in their feet. And so you want to make sure that someone's having a look to make sure you don't have a sore or something that's going to become more of a problem if it's not addressed right away. Want to make sure to be checking your blood sugars and taking your medications as prescribed. And then to call your health team if there's any adjustments that need to be made because your blood sugars are rising. I think those are the key points I'd like to point out today.
Great advice, Dr. Goulet. And so really it's keep taking care of your diabetes and practice the good hygiene that every citizen's being advised to practice in order to minimize your risk of developing COVID. I think I would note for our viewers that there are fantastic resources available that can help those affected by diabetes get in touch with more, whether it's more information or educational programs. I would refer to the website of the National Indigenous Diabetes Association, NIDA, also to the website of the Indigenous Diabetes Health Circle. And per the suggestion of one of our viewers, we at Diabetes Canada will make sure that when we post the recording of this video to our YouTube channel later this week, we'll include the links to those websites in the comments so that it's easy for all of our viewers to refer to those sources. I also wanted to just take a brief moment to let our viewers know about some resources that Diabetes Canada is making available for everyone that may be of use. And just please encourage any of our viewers who have questions to submit them, again, via the Q&A function if you're watching on Zoom, or via Facebook comments if that's how you're joining us today. So wanted to remind everyone that now more than ever, Diabetes Canada is here to support Canadians affected by diabetes. We're offering more informational resources via our website and our social media channels. This is an example of them. As Dr. Goulet mentioned, we have an information line at 1-800-BANTING, BANTING, that you can call for information about, general information about diabetes. If you have questions about how you might access government programs that can help you afford your medications or devices, or address other aspects of living with diabetes. And that can also provide you with contact with a certified diabetes educator who can answer your specific questions about your health if you have any. We're sharing lots of videos on our YouTube channel and social media, answering the questions that viewers are most commonly asking. And we're bringing a number of virtual conferences to Canadians throughout the rest of this year. So do please visit Diabetes Canada's website if you're interested in whether it's a conference for people with type 1. We're having a fun program in September to get everybody active called Lace Up for Diabetes. So there's lots of interesting things that you can access. We are also working to keep healthcare providers up to date on the latest research relating to COVID-19 and diabetes so that they can provide the best care to those of us affected by diabetes. And we really want to stay connected with you to ensure that we're meeting your needs and answering your questions. So please never hesitate to reach out to us. So I'm going to just make sure that we've got no questions here, and none so far. So we're getting close to the end of our time together today. I'd like to ask each of our experts to offer some concluding remarks. And so I'll give Minister Chartrand and Dr. Goulet a moment to sort of gather their thoughts while we watch a brief video from Minister Vandal.
Listen, it's been a great pleasure being here, and thanks for having me, and I look forward to further conversations. Thank you.
Thanks, and really appreciate Minister Vandal. He wasn't able to participate with us live, but it was great to include him and have his perspective as part of this webinar. So thanks to Minister Vandal. Minister Chartrand, anything that you'd like to share with our viewers by way of concluding remarks?
Just before I sign off, I just want to remind everyone that today is Manitoba's 150th birthday.
Happy
And
birthday, Manitoba.
the government is celebrating with fireworks all across the province of Manitoba. So we understand it's a contained event. It's at 10:45 p.m. tonight. Simultaneously across the province of Manitoba, in the city of Winnipeg, Selkirk, Manitoba, the Pod, Dauphin, West St. Paul, all the way up to Churchill and various communities, local communities across the province of Manitoba will be setting off fireworks celebrating Canada. So although the Manitoba Act received royal assent on May 12th, 1870, July 15th, 1870 is the day that the province of Manitoba was enacted. So even though the Premier of Manitoba and Manitoba is not celebrating Manitoba becoming a province in today's 150th birthday, the Metis government is celebrating, and I want to invite everyone. Of course, we're practicing COVID-19. We want people to stay home, and you could go and watch the fireworks, or if you're going to go down to the site, you'd stay in your car, but we're recommending that people could just watch from home. In the Northwest region, which is the Parkland area, we'll be having fireworks in the community of Minitonas, the community of Duck Bay, Winnipegoses, the city of Dauphin, and Manitoba House. So I want to welcome everyone to come out and maybe have a piece of cake celebrating all of the commitment, hard work of Manitoba becoming a province, and honor our great leader, Louis Riel. So I want to thank Diabetes Canada, Dr. Goulet, and the Minister for having us here today. And we have a lot of information regarding COVID-19 and safety practices within the province of Manitoba. We have daily updates, and I want to thank all of you for all your help and support. Thank you very much.
Thank you, Minister. Dr. Goulet, last word to you.
Oh, well, thank you very much for inviting me. This has been very educational, and I am very thankful to be a part of it. I actually didn't realize it was Manitoba's birthday, and that's very exciting to hear all that that Minister Chartrand's doing, and to celebrate, and the MMF makes me very proud to be Métis. And just to say to everyone to stay safe and to use this time to take care of yourself and your family, and to focus on your health and wellness.
Fantastic. Thank you, Dr. Goulet. Minister Chartrand, we have one question from a viewer who's wondering if you are open to one-on-one conversations regarding the programs that you've discussed. Can viewers reach out to your office if they would like to try to arrange time to meet with you?
Yes. So I'm situated in the city of Dauphin. Our office is at 41st Avenue Northwest. We have regional offices right across the province, and we work with our Métis Community Liaison Department staff. All our contact information is on our website, and you could also contact us at 150 Henry, and our phone number is 204-586-8474, and they could ask for Dr. Julian Sanguis, who is our acting director right now. You could also contact the Immuno Pharmacy and request to speak to Shanley Scott, and we'll make sure that we could set up a private one-on-one conversation, or we could get staff to deal directly with our citizens.
Fantastic. Thank you for that. And we'll be sure to include a link to the Federation's website in the comments when we post this video to YouTube. So thank you for that, Minister Chartrand. I'd really like to thank all of our viewers for joining us today. We really hope that this was helpful information for you, and would be pleased to have you reach out to Diabetes Canada with any further questions that you might have. In the meantime, happy birthday to Manitoba, and everyone, please be well.